We're going to be doing evaluation techniques for the acetabulofemoral joint. First, I'm going to start with palpation. I'm going to palpate the patient's anterior superior iliac spine. Then I'm going to go into a glenometric measurement of hip flexion. The expected degrees of range of motion are from 0 to 120 degrees. I'll start by palpating the patient's greater trochanter. Right here, I'm going to place the fulcrum over the greater trochanter while the stationary arm stays parallel with the axis of the body, and the movement arm stays parallel with the axis of the femur. And have the patient actively flex her hip through a full range of motion, which is roughly about a little over 100 degrees. Now I'm going to take the patient and I'm going to do passive hip flexion, grabbing at the proximal tibia, pushing the patient to her end range, which is going to have an end field of soft tissue approximation. I'm going to have my patient sit up to do a manual muscle test of the iliopsoas. My stabilizing hand is going to stabilize the opposing hip, while my resistance hand is going to be at the distal femur. And I'll have the patient actively flex through a full range of motion and relax. Okay, I will then go into neurological testing. The dermatome for the iliacus and for the psoas is the femoral nerve. So I can do sensory on L1, L2, or L3 to test for that. And then the lumbar plexus is responsible for the motor movement of that muscle, and it's the same test that I did for my manual muscle test. So again, supporting the opposing hip, applying resistance at the distal femur, and asking the patient to actively flex through a full range of motion. Okay, and then for my last part of my evaluation, I'm going to have a patient do the Trendelenburg test. I'm going to have her stand down. I'm going to have her face away from me. She's going to stand on her affected side, whichever that is, so we'll say it's the left side. And you're going to watch and see if the patient's hips drop to the opposing side. If it does, that indicates a positive test, which is positive for glute medius insufficiency. That concludes my evaluation of the acetabulofemoral joint. Okay, we're going to go over evaluation techniques for the glenohumeral joint. First, I'm going to start with palpation. I'm going to palpate the acromioclavicular joint, right here. Okay, I'm going to have my patient lay supine to do a glenometric measurement of shoulder flexion. I'm going to take the fulcrum of the goniometer, place it over the acromion process, keeping the stationary arm level with the body, while the movement arm will track the motion with the humerus. Okay. So I'm going to have my patient flex her arm. And we'll make my measurement roughly 160 degrees of flexion. Generally it's 0 to 180 is considered normal. Okay. With my patient supine, I'm going to go through a passive range of motion technique, putting my patient into external rotation. I'm going to apply stationary pressure to the anterior aspect of the glenohumeral joint while externally rotating the patient to get a firm end feel. Okay. I'm going to have my patient sit up at the edge of the table to do a manual muscle test of shoulder flexion. I'm going to apply direct pressure over the AC joint while holding over the cubital fossa. I'll resist with my right hand while supporting with my left as the patient flexes through the range of motion to the top. Okay. Now I'll go over neurological testing. So I'm going to do the axillary nerve, which is most of the deltoid right here, which is the dermatome and the myotome. I can have the patient hold here as I apply direct pressure over the joint. For my pulse site, it'll be the brachial artery, located right around the center of the biceps brachii muscle, just over like mid-humerus. Now I'll have the patient lay supine. For Ryan test, I'll apply axial load into the glenohumeral joint of the humerus. I'm going to rotate back and forth. This should recreate symptoms for slap lesions. A positive test would be indicated with pain. Okay. That concludes my assessment of